If you are over the age of 55, I know your morning ritual. You swing your legs out of bed, and immediately that dull, grinding ache starts. Your knees protest the movement, your lower back stiffens up like concrete, and maybe your fingers are too swollen to grip your coffee mug properly. You reach for the bottle of Advil, Aleve, or whatever NSAID you prefer, just to take the edge off and get through the first hour of the day. And you probably hate doing it. You hate the reliance on pills that only offer temporary relief, pills that you know, deep down, are quietly eroding the lining of your stomach, straining your liver, and possibly even elevating your blood pressure. For too long, we have treated the pain of aging like a pharmaceutical deficiency. We've been told that joint deterioration and muscle weakness are inevitable, irreversible byproducts of simply existing for decades. We are told to manage the pain, never to eliminate the cause. But what if I told you that the chronic joint pain that steals your sleep and the creeping leg weakness that threatens your independence aren't inevitable? What if I told you there is a single, powerful nutrient, something your body is designed to create naturally, that acts like a targeted demolition crew against inflammation, rebuilds your cellular resilience, and fundamentally strengthens the fast-twitch muscle fibers in your legs that are vital for preventing falls? We're not talking about expensive injections, complex physical therapy, or yet another bottle of temporary pain relief. We are talking about something so fundamental, so misunderstood, that correcting its deficiency can feel like reversing 10 years of aging overnight. Today, we are going deep into the science of a remarkable vitamin, a vitamin so potent, so essential to musculoskeletal and immune function, that once you understand its mechanism, you will finally understand why Advil is nothing more than a Band-Aid on a gaping wound. This single nutrient is
not just effective. For millions of seniors, it is the missing linchpin holding their entire physical structure together. Before we delve into the extraordinary science behind this anti-aging powerhouse, take a moment. If you are serious about restoring your joint health, reclaiming your strength, and living an independent, pain-free life, hit that subscribe button right now. Join our community dedicated to proactive, evidence-based aging. The stakes here are far higher than just discomfort. We aren't just discussing sore knees. We are discussing the preservation of independence. Joint pain and declining leg strength are the twin architects of sarcopenia, the age-related loss of muscle mass and function. Think about what happens when your legs weaken. First, you hesitate on the stairs. Then, you start avoiding uneven sidewalks. You stop crouching down to play with your grandkids. Eventually, the fear of falling, the primary life-altering fear for seniors, begins to dictate your movements, shrinking your world down to the radius of your home. A fall, especially after age 65, is often the beginning of the end of true independence. It leads to fractures, long hospital stays, and a devastating loss of baseline mobility. Meanwhile, the standard approach, relying on daily NSAIDs, creates its own dangerous path. Chronic use dramatically increases the risk of heart attack, stroke, and irreversible kidney damage. You are trading short-term relief for long-term systemic failure. You are stuck in a terrible loop. Your joints hurt, so you take damaging medication. Your muscles weaken, increasing your risk of falling. And you continue taking medication to mask the symptoms of underlying decay. The terrifying reality is that most seniors are profoundly deficient in the very nutrient that could break this cycle. The nutrient that acts directly on the muscle fibers, fortifies the bone matrix, and dramatically lowers systemic inflammation, making the daily need for Advil obsolete. This nutrient isn't just a supplement, it's a protective shield against the most common threats to longevity and quality of life. The vitamin we are discussing today, the one that holds the key to eliminating chronic joint pain and fundamentally strengthening your legs, is vitamin D3. But we must immediately dismiss the notion that this is just a bone vitamin we learned about in grade school. That simplification is dangerously inaccurate and has led to mass misapplication. Vitamin D3, scientifically known as cholecalciferol, is not actually a vitamin at all in the traditional sense. It is a powerful secosteroid pro-hormone. This distinction is critical because hormones regulate complex systemic functions, while vitamins primarily assist metabolism. The fact that D3 functions as a hormone explains its profound and wide-ranging effects on nearly every system in your body, particularly your muscles, bones, and immune response, the very core triumvirate of joint health. The hormonal master key, vitamin D receptors, VDRs. We call D3 a hormone because it operates through dedicated receptors found on the nucleus of cells throughout your body, regulating gene expression. It literally turns genes on and off. These are the vitamin D receptors, or VDRs. Think of D3 as a master key and the VDRs as locks. When D3 binds to the VDR, it unlocks a cascade of biological instructions. Where are these VDRs located? Everywhere. The thyroid, the brain, the heart, the pancreas, the lining of your gut, and, most pertinent to our discussion, absolutely saturating the immune cells, muscle tissue, and bone cells. This ubiquity explains why a deficiency in D3 creates such systemic chaos, manifesting first and most painfully in joint inflammation and muscle weakness.
Phase 1. Silencing the inflammation, the anti-Advil mechanism.
Let's start with the joint pain component, the forget Advil promise. Joint pain is, at its root, inflammation. Whether it's osteoarthritis wearing away cartilage or rheumatoid arthritis being an autoimmune attack, the daily agony comes from inflammatory compounds called cytokines flooding the joint space. Vitamin D3 is an unparalleled modulator of the immune system. When adequate levels of D3 bind to the VDRs in immune cells, T cells, B cells, macrophages, it literally tells the immune system to turn down the volume on inflammation. D3's anti-inflammatory power is sophisticated and upstream. It actively suppresses the production of the most notorious pro-inflammatory cytokines, specifically tumor necrosis factor alpha, TNF-alpha, interleukin-1 beta, IL-1 beta, and interleukin-6, IL-6. These are the very chemical messengers responsible for the heat, swelling, stiffness, and deep throbbing pain in your knees and hips. Chronic pain is often described as a cytokine storm in the joints. D3 helps calm that storm. Contrast this with NSAIDs like Advil. NSAIDs work by blocking certain enzymes, COX-1 and COX-2, that produce inflammatory prostaglandins. They are a brute force approach, simply blocking the pain signals after they have already been created. Vitamin D3, however, works much earlier in the process. It adjusts the entire immune signaling pathway, calming the underlying cellular hyperactivity that caused the excessive inflammation in the first place. Studies consistently show that individuals with chronic, nonspecific musculoskeletal pain, the kind that makes you reach for the bottle every morning, often see their pain scores plummet simply by raising their serum D3 levels from deficient, below 30 nanograms per milliliter, to optimal, 50 to 80 nanograms per milliliter. Correcting this deficiency is not treating a symptom, it is addressing the inflammatory root of the problem itself, offering sustained relief that Advil simply cannot match.
Furthermore, D3 is crucial for maintaining the integrity of the intestinal barrier, what's often called leaky gut. A compromised gut barrier allows inflammatory molecules to enter the bloodstream, contributing to systemic inflammation that fuels conditions like rheumatoid arthritis and generalized aches. D3 helps strengthen the tight junctions between gut cells, reducing the inflammatory load that contributes to joint discomfort elsewhere in the body. Phase 2. Building resilience, reversing sarcopenia, and preventing falls. Now, let's pivot to the second, equally crucial promise, strengthening your legs and preventing falls. This is where the hormonal nature of D3 truly shines, acting directly on the muscle fibers themselves. Your skeletal muscles, the ones responsible for walking, balance, and rising from a chair, are riddled with VDRs. When these VDRs are activated by sufficient circulating D3, several transformative things happen inside the muscle cell, particularly concerning energy and contraction. First, vitamin D facilitates the uptake of calcium into the muscle cell and optimizes the function of the sarcoplasmic reticulum, the internal storage unit for calcium within the muscle fiber. Calcium is the essential trigger for every single muscle contraction. Low D3 means poor calcium signaling, leading to weak, uncoordinated, and sluggish contractions, resulting in generalized muscle weakness, technically known as vitamin D myopathy.
Focusing on type 2 fibers. More importantly for seniors, vitamin D3 plays a pivotal role in maintaining and regenerating type 2 muscle fibers.
These are the fast-twitch, powerful fibers crucial for quick, explosive movements, the kind of rapid reaction needed to catch yourself when you trip on a rug, or the burst of power required to get up off a low sofa or climb a flight of stairs. As we age, we disproportionately lose type 2 fibers. This loss is the primary driver of sarcopenia, the loss of muscle mass and function, and the corresponding dramatic increase in fall risk. Adequate D3 status directly supports the satellite cells, which are essentially muscle stem cells. These cells are responsible for muscle repair and hypertrophy, growth. By keeping D3 optimal, you enable faster repair and maintenance of these critical fast-twitch fibers, effectively slowing the rate of sarcopenic decay. Clinical trials involving seniors demonstrate this perfectly. Participants with corrected D3 deficiency show measurable, profound improvements in functional tests. The timed up-and-go tug test, a key measure of mobility and fall risk, shows faster times, meaning participants can stand up from a chair, walk a short distance, turn, and sit back down quicker. They also show improved quadricep strength and better dynamic balance. This is physical resilience being built from the cellular level up, proving that the strength and quickness required for independence are entirely dependent on achieving and maintaining optimal D3 status. Phase 3, the necessary foundation, bone health and parathyroid regulation.
While we focused on inflammation and muscle, we cannot neglect D3's foundational role in bone health, which provides the structural stability for the joints. D3's most famous role is promoting calcium absorption in the gut, but its role goes deeper. When D3 levels are low, the body tries to compensate by releasing parathyroid hormone, PTH. Elevated PTH is detrimental because it signals the body to release calcium from the skeletal stores. That is, it leaches calcium directly from your bones to maintain blood calcium levels. This continuous withdrawal weakens the bones, leading to osteopenia, osteoporosis, and microfractures that cause chronic, deep bone ache and instability around the joints. When D3 is optimal, 50 to 80 ng per ml, PTH levels drop dramatically, preserving bone density and ensuring the skeletal structure surrounding your joints remains strong, firm, and fracture-resistant. Strong, dense bone is a necessity for reducing the mechanical stress that contributes to joint pain. The Cofactor Trinity, D3, K2, and Magnesium, precision supplementation. This is the part most physicians overlook, rendering many high-dose D3 treatments ineffective or even potentially harmful. The efficacy of D3 is non-negotiably tied to two critical cofactors, vitamin K2 and magnesium. The K2 traffic controller. While D3 significantly boosts the absorption of calcium from your gut, up to 20 times the baseline, K2 is the essential traffic controller for where that calcium ends up in your body. This synergy is crucial for joint and cardiovascular health. If you only take D3, you absorb more calcium, but without K2, that calcium might deposit into soft tissues. This ectopic calcification stiffens blood vessels, hardening of the arteries or atherosclerosis, and critically for joint health, can deposit in the cartilage, joint capsules, and soft tissues, leading to stiffness, reduced mobility, and chronic pain, sometimes mimicking or exacerbating certain types of arthritis. You are simply moving the problem. Vitamin K2, specifically the minoquinone 7 MK7 form, because of its superior bioavailability and long half-life, activates two vital proteins, matrix GLA protein, MGP, and osteocalcin. MGP acts like a guard dog or an inhibitor, actively preventing calcium from depositing in soft tissues, like arteries and joints. Osteocalcin, meanwhile, ensures the absorbed calcium is driven directly into the bone matrix, improving bone density, stabilizing the joints, and repairing the skeletal fragility that causes pain. For seniors aiming for optimal D3 levels, pairing D3 with 100 to 200 micrograms of K2, MK7, is a mandatory step for safe and effective treatment. The Magnesium Activator.
Magnesium is the second, equally vital cofactor. If you are taking high-dose D3 without sufficient magnesium, you are wasting a significant portion of it. Magnesium is required for nearly every enzymatic step involved in converting inert D3, cholecalciferol, into its active hormonal form, calcitriol, 1,2,5-OH2D. Specifically, magnesium is the required partner for the 25-hydroxylase enzyme in the liver and the 1-alpha-hydroxylase enzyme in the kidneys. These enzymes perform the two conversions necessary to make D3 biologically active. Without sufficient magnesium, the conversion stalls, and your body cannot utilize the D3 you are taking, even if you are swallowing large doses. Magnesium deficiency is rampant in seniors, often exacerbated by common medications like proton pump inhibitors, PPIs, used for reflux, making comprehensive supplementation of magnesium, often 300 to 500 milligrams daily, essential for D3 effectiveness and overall muscle function. The deficiency crisis and the action protocol. The profound deficiency crisis in seniors cannot be overstated. Due to environmental factors, up to 70% of the elderly population in many Western countries is deficient. Why? Because the primary natural source, sunlight, becomes ineffective with age. As we get older, our skin's ability to synthesize D3 from UVB radiation decreases by up to 75%. Coupled with indoor lifestyles, pervasive sunscreen use, which blocks D3 synthesis entirely, and geographic location, anyone living north of the latitude of Atlanta, Georgia, cannot synthesize adequate D3 during winter months. Supplementation is often the only reliable path to optimization.
The critical numbers. You must know your numbers. The gold standard diagnostic test is the 25-hydroxyvitamin D test, often labeled 25-OHD. Do not accept the outdated medical standard of 30 nanograms per milliliter as normal or sufficient. While 30 prevents severe bone diseases like rickets, it is entirely insufficient for optimizing immune function, muscular strength, and chronic pain management. For proactive joint and muscle health and true anti-inflammatory benefits, you should aim for a therapeutic serum range of 50 to 80 nanograms per milliliter, Ng per ml. Achieving this often requires daily supplementation doses ranging from 4,000 to 10,000 international units (IU) of D3, which is far beyond the minimal daily recommendations. This targeted approach, D3 as a hormone, its direct anti-inflammatory and muscle-building effects, and its absolute need for K2 and magnesium cofactors, is what differentiates effective treatment from random pill popping. This precision methodology is how you move from chronic pain management to cellular regeneration and true physical strength, making the temporary relief promised by Advil pale in comparison to the sustained, profound benefits of correcting this hormonal deficiency. It is the single most powerful, cost-effective intervention available today to reclaim your physical independence. If this deep dive into the science of joint and muscle health has opened your eyes to a better way forward, don't miss our next video. Make sure you are subscribed and hit that notification bell so you can continue building a body that supports a long, active, and pain-free life.
Imagine waking up tomorrow, swinging your legs out of bed, and instead of the usual grinding hesitation, you feel stability. You move with purpose, not caution. The inflammation is quiet. The VDRs in your immune cells have successfully calmed the storm, and the fast twitch fibers in your legs, newly nourished and resilient, feel capable and ready. This isn't just about reducing a pain score, it's about reclaiming territory that age tried to steal. It's about looking at a set of stairs and choosing to take them 2 at a time because your legs feel strong, not brittle. It's about having the physical stamina to keep up with your grandkids all day or taking that long, satisfying hike you used to dream about. You are replacing the fear of falling with the confidence of competence. You are trading the damaging cycle of pharmaceutical dependency for the sustainable power of hormonal balance. The solution to eliminating joint pain and strengthening your foundational resilience was never in a pill bottle labeled Advil. It was in correcting a fundamental, decades-long nutritional oversight. Your immediate action plan is clear and essential. Step 1. Contact your healthcare provider and request the 25-hydroxyvitamin D blood test, specifically requesting the results and not just a normal stamp. Step 2. Based on those results, work with a knowledgeable practitioner to safely achieve and maintain a therapeutic serum level of 50 to 80 nanograms per milliliter, which for many means starting a daily regimen of D3 combined strictly with vitamin K2, MK7. Do not skip the K2. Step 3. Ensure your diet or supplementation includes sufficient magnesium to activate that D3. This isn't complicated, but it requires commitment and precision. Stop masking the pain. Start strengthening the core foundation of your body. Embrace this hormone-like power, and you will find that the promises of joint mobility and powerful leg strength are not relics of your youth, but attainable goals for your vibrant future.